Welcome to this explainer. Today, we're tackling a massive, but often totally silent crisis, and that's chronic pain. For decades, millions of people have suffered from this intense agony that nobody else can actually see. And that invisibility, it leads to a terrible struggle and a whole lot of societal stigma. But what if we could actually look inside the physical brain and validate that experience? Today, we're unmasking chronic pain. We're going to look directly at the brain's physical structure to really understand the science of suffering.
Okay, let's dive into this. 20%. Think about that for a second. That means literally 1 in 5 Americans is currently living with chronic pain that severely impacts their daily life. And we're not just talking about, a temporary ache from a sprained ankle or a random headache. We are talking about persistent, life-altering pain that completely hijacks a person's physical, emotional, social, and even financial well-being. It is a true epidemic of suffering.
And the staggering reality of the struggle, it doesn't just stop with the pain itself. To put this into perspective, overdoses killed more than 93,000 people in the year 2020 alone. It was an agonizing spike driven largely by the opioid epidemic. Now, while the causes of this epidemic are incredibly complex, a massive driver is simply people desperately seeking relief for chronic, unyielding pain. When standard treatments fail, that sheer desperation to just quiet the nervous system can have absolutely devastating and sometimes fatal consequences.
So this brings us to a deep, frankly agonizing frustration for countless patients. Just imagine going to doctor after doctor, right? You're undergoing endless scans, tests, and medical evaluations on the exact part of your body that is just screaming in agony. But time after time, the doctors tell you the tests reveal nothing. Literally nothing physically wrong at the specific site of the pain. It's maddening. But it leads to one incredibly difficult, totally paradigm-shifting question: what if the pain isn't actually where it hurts?
See, for decades, medicine operated heavily on something called the spinal gate theory. We used to think of acute pain as this simple protective relay. You touch a hot stove, the peripheral nerve sends a quick signal, and you pull your hand away to protect yourself. Makes sense, right? But our modern understanding completely flips this view of long-term suffering on its head. Chronic pain is now recognized as a maladaptive central nervous system issue. We call it central sensitization. The pain isn't just some helpful protective response to a local injury anymore.
And this brilliantly illustrates what central sensitization actually is. It's a state where the central nervous system undergoes real structural, functional, and neurochemical changes, making it intensely hyperexcitable to stimuli. Think of it kind of like a faulty amplifier in the brain. The body's sensory volume has essentially been cranked all the way up to an 11, and then the dial just snapped right off. Even in the complete absence of a new physical injury, the brain's neural pathways are basically amplifying normal, everyday signals into severe pain.
Now, this faulty amplifier creates what we call the central sensitization trifecta. Let's break these down, because understanding them is absolutely crucial to empathizing with what these patients go through every single day. First up is hyperalgesia. This is when a mildly painful stimulus hurts incredibly worse than it normally should. Second is allodynia. This one's wild. It's when a completely non-painful stimulus, like a gentle hug, clothes rubbing against your skin, or even just a heavy blanket, causes absolute agony. And third is global sensory hyperresponsiveness. That's an overwhelming sensitivity to external stuff, like bright lights, loud sounds, or even strong smells. The nervous system is just stuck in a constant state of overwhelm.
For the longest time, these intense symptoms were, sadly, dismissed by a lot of folks because they couldn't be easily seen or, measured with a standard blood test. But now, science is proving the invisible. There was this fascinating study published in the journal Frontiers in Psychology. They looked at 33 female patients with fibromyalgia, which, by the way, is a classic centralized pain condition, and compared them to 33 healthy controls. But they didn't just ask about their symptoms. No, they used advanced multiparametric MRI techniques to find literal, physical proof of this pain woven directly into the brain's architecture. We are about to zoom way in here.
Now, to truly grasp their findings, we need to understand exactly what they were measuring. Let's use a landscape analogy to make this dense data crystal clear. Cortical thickness is kind of like the density of a forest. It measures how tightly packed the neurons are. Fractal dimension? That's like the complexity of the paths winding through that forest, how irregular the shapes get. Then there's the gyrification index, which is all about the surface folding of the brain. Think of it like rolling hills. And finally, sulcal depth measures the profoundness of the sulci, which is essentially the depth of the valleys in this brain landscape. They measured all of this just to map out the physical terrain of chronic pain.
Now, what's really interesting about this slide is the sheer visual proof. Check out these complex brain maps. Notice the red areas. Those represent regions where the fibromyalgia brain has significantly greater measurements than the healthy controls. The blue areas show where the measurements are significantly less. This absolutely proves the pain isn't just in their minds. It is right there in the physical tissue. The brain is literally thickening, thinning, and folding differently to adapt to this chronic pain. The structure itself has physically changed across multiple different parameters.
Let's isolate one truly mind-blowing finding here. Look at the intense red areas scattered across the fractal dimensionality map. These are the sensory motor regions, specifically an area called the post-central gyrus. Now, this area acts as the primary somatosensory cortex, the very part of your brain responsible for processing physical sensations and touch. In the fibromyalgia patients, the structural complexity here is significantly greater. This hyperreactivity and increased structural complexity, right in the touch processing center, that is the direct physical manifestation of that faulty amplifier of central sensitization we talked about earlier.
But the researchers went a step further, and this is where it gets really compelling. They mapped these structural changes directly to clinical symptoms. They found that alterations in the cortical thickness of a region called the caudal anterior cingulate cortex, or CACC for short, correlated directly with severity on standardized scales for depression and anxiety. Meanwhile, those structural changes we literally just saw in the hyperactive postcentral gyrus, those correlated with high scores for alexithymia. That's a condition where patients really struggle to identify and process their own emotions.
So, the crucial point is this. The cognitive difficulties we often call fibrofog, the intense emotional distress, the deep struggles processing emotions, they are real physical symptoms rooted in altered neural networks. They are structurally linked to the brain itself. They aren't fabricated, they aren't imagined, and they are definitely not just psychological complaints to be brushed aside. This data perfectly validates the total mind-body link, proving that chronic pain fundamentally alters the physical architecture of how we think and feel.
Honestly, this builds toward a much more hopeful future for patients. Just educating patients about the actual physiology of their pain has consistently been shown to vastly enhance their ability to manage it. When patients understand neuroplasticity, when they realize, oh, my brain has structurally adapted and become sensitized, it actually removes that terrifying fear that their bodies are constantly suffering new tissue damage. This knowledge is profoundly empowering. It shifts focus away from potentially harmful, escalating opioid treatments and points folks toward highly effective non-pharmacologic management strategies, like cognitive behavioral therapy.
We started this explainer looking at the isolating stigma of chronic pain, and we've arrived at visible, scientifically backed structural validation. Which leaves us with one final critical question to chew on. If we fundamentally change how we see pain, not just as a peripheral symptom of some local injury, but as a structural, physical change within the central nervous system itself, how will that revolutionize how we treat it? It's a massive paradigm shift, one that could literally rewrite the future for millions of people living in pain. Thank you so much for learning with me today, and hey, keep questioning what you see and especially what you can't.